And welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Good morning and welcome to this Monday Morning Minute. I'm Dr. Todd Shatkin, and today we're going to be placing 2 mini implants at tooth number 14. My patient had number 14 extracted in September, so it's been over 6 months now, and we're going to go ahead and get him numb. Just as a recap, I love to use Septocaine for my implant procedures, whether they're upper or lower. It's a very profound anesthetic. It works very quickly, and patients aren't numb for the whole day. It wears off relatively quickly, but it's very, very quick acting and short acting. So I'm going to get him numb. I did not have a surgical guide made on this case, but we're going to freehand these. They're pretty quick and easy. A little numbing here, a little pinch. All right, here's the x-ray. This was taken a couple months ago. He had the tooth taken out again in September, so we're looking at the bone, and we're going to place the implants a little bit toward the palatal because the bone seems stronger that way, so we're going to angle them a little palatal, and I'm going to use 2 2-5-11 implants. All right? Okay, here we go. You nice and numb? Feeling okay? Take it easy and relax, okay? You're going to be just fine, Tom. Okay. Everything's going to be great. He's a little nervous patient, but he's going to do great. We've done a lot of work with him over the years. We have our Shatkin F.I.R.S.T Septocaine motor here. This is set to setting number 1. Let's just go through that again. Pilot drill. We use a 20-to-1 reduction, 2,000 RPMs, 55 Newton centimeters of torque, and we use a 30% water flow. Make sure the water is flowing out of the handpiece. Turn your head toward me a little bit. Again, I'm going to start with the distal implant. We're going to angle it a little bit toward the palatal. Let me just see here. Okay, we made our first hole. There's our 2.5 by 11 Shatkin F.I.R.S.T implant. Again, these are the Intra-Lock Shatkin F.I.R.S.T implants with the Ossean coating. Don't underestimate the Ossean surface and the blossom thread design that Dr. Terry Giorno spent so much time designing and meticulously manufacturing these implants for success. If you look straight down on the implant, you'll see the blossom thread. These are what makes the mini implants from Shatkin F.I.R.S.T special and encourages their osseointegration. Okay, we got good torque on that first implant. Nice and solid. We're going to go ahead and make our second pilot hole. Okay, we're going to go ahead and put our second implant in. 2.5 by 11. Always have your assistants tell you the size of the implant when they hand it to you, because that's how mistakes happen. So we always want to hear that and confirm.
Yes, that is 2.5.
You've heard of people amputating the wrong limbs? We don't let that happen here. We put the right implant in that we want. Okay, good torque resistance again on that mesial implant. We got our 2 implants in, You can see there's a slight palatal angle. That was purposeful because I know from the x-ray that the bone looks more dense and larger on the palatal side, a little bit deeper. So bite together for me. That's great. We got good vertical space between the upper and lower. You can notice that the square and the ball are above soft tissue. You want only the square and ball above the soft tissue, and that's what we've got here. Okay, we're going to go ahead and take our final impression because we received 30 Newton centimeters of torque on both implants. I should say achieved 30 Newton centimeters of torque, and we're ready to take the final impression. So we're just going to use, you can do digital impressions if you prefer, but I'm still old school most of the time using polyvinyl impressions. And I'll just send it over to Shatkin F.I.R.S.T lab and have the crown fabricated. And I'll have one of my wonderful assistants here put a temporary on him for a couple of weeks. Okay, and bite together nice and tight, Tom, in the back. Yep, right there. All right, hold that together, okay? And we did his implants on the other side of his mouth. You can take a look at the x-ray here on the lower right side back several years ago. He did have one implant break during placement back there, but we put plenty of other ones in. And he's doing just fine with those. Keep biting, my friend. So you just observed us placing 2 mini implants for tooth number 14 to replace his tooth that he lost 6 months ago. Quick, easy procedure. My staff member made a nice temporary out of rope composite or bulk fill composite with a couple healing caps. That's a very simple procedure to replace a single tooth, much easier than the old-fashioned way of putting the implants in, waiting 4 to 6 months. Second surgery, third procedure to put the abutment on and then the crown, and it just takes a lot of time and visits. The mini implants are fantastic. When I had tooth number 15 replaced in my mouth, I opted for the 2 mini implants and the permanent crown, and that's been in there now for 7 years. It's the best thing in dentistry. I love doing them every day, and we change patients' lives all the time. Thank you for joining me on this Monday Morning Minute, and don't forget to come June 5th, 6th, and 7th to our upcoming advanced 3-day program with 2 days of tremendous learning about mini implants and a 3rd day of Botox training. It's a half a day on Saturday, Botox from 8 until noon. And then I hope all of you will join us and come to my birthday celebration. I'm going to be turning the big 6-0, and I'm going to have all of you in my yard for a big celebration. So please come visit us here in Buffalo June 5th, 6th, and 7th. Can't wait to see you all at that weekend meeting. Thank you for joining me on the Monday Morning Minute. We'll see you next time.
Join Dr. Thomas Baggett, Dr. Randy Staples, and of course the birthday boy himself, Dr. Todd Shatkin. And they will be sharing their over a century of implant experience with all attendees at our course. And then on Friday afternoon, Dr. Samuel Shatkin will be giving a lecture on Botox and dentistry and how to save those restorations that you work so hard on. On Saturday, Dr. Samuel Shatkin will be doing a hands-on Botox lecture. The course will go from 8 a.m. till noon. Anyone who's interested in learning to do Botox hands-on with live patients, this is your course. Sign up today for this exciting advanced course in Buffalo. Join us on June 7th to celebrate a major milestone, Dr. Todd Shatkin's 60th birthday party. We're hosting a backyard barbecue and a pool party at his home, and you're invited. The day kicks off with continuing education, so come learn, connect, and grow. Then stay for the food, friends, and fun as we honor Dr. Shatkin's incredible legacy. It's a celebration you won't want to miss and a memory we'll make together. RSVP today, and we look forward to seeing you there.